We are here at Residence 600, an independent living facility here in Salina. As part of our panel here of 4, we're going to be discussing Alzheimer's and the reorganization of our local group. So I would just turn it over to someone that might want to start. Dr. Hutchinson.
I'm Dr. Hutchinson, and I'm the medical director of the group, and I'm here primarily as a medical resource person. And actually I'm new at the job, so I don't know all of my duties yet, but I'm finding out.
Thank you, and that's true. We've been organized in some fashion for the past 4 years and have met every Tuesday as a local Alzheimer's group, but due to the fundraisers and so much help from the other folks with donations, we decided to reorganize, and we have really vamped that up with a policy and procedure to do something for the local community with those funds and carry this on in a way of being sustainable. I might ask Tammy to expand on that.
Okay, my name is Tammy MacArthur. I became involved with the group. Velma and I have been friends for years, and I actually had a family member that we went through the Alzheimer's disease process this last year, and so have become very interested and was involved in a lot of fundraisers to give money back to this group. Wanted the money to be able to stay locally. And so with looking at the way they had it set up, we decided that we needed to have a board members and our own tax ID and become a real local group the money would stay in Salina to support the people in Salina that need the resources. So it's a way for the board to be able to make decisions, not just one person, about where that money needs to go.
Lori is our social worker, a board member and officer. We appreciate your being here with us, Lori. You want to tell some of the things that you do?
I'm a social worker, and when I found out that Velma was doing the Alzheimer's support group, I wanted to be part of it. I contacted her and asked if I could attend some of the meetings. I wanted to learn what some of the family members were experiencing. I wanted to provide support to them and just wanted to be of service to them and to provide emotional support and educational resources for them. So I would approach Velma with different topics for some of the sessions, and we would discuss those during the group. So I'm really pleased to be part of this, and I'm just really happy that it has grown from just a few people to the number that attend today. So I would like to see this continue to grow, and I'm just really pleased to be here. Thank you.
And that's true. Lori has been with me nearly from the beginning as a social worker, and has expanded her duties and degree, and that's been very helpful to have that professional resource. So I've appreciated Lori so much. And again, I'm Velma Howie, RN, the facilitator. We have met here to put a little of this on the video for the Access Television. Mainly, several reasons. We have moved here to Residence 600, that's located at 600 East Elm in Salina. Because we keep growing, it just seems like Alzheimer's, dementia, Alzheimer's is not going to go away anytime soon. So each week, or for sure each month, we have 1 or 2 or 3 new members. So from way back when, there's a roster of between 40 and 50 persons that come off and on. They can't come every week. Of course, if there's something going on with their own health or their loved one. So we have moved to a new facility. The date has not changed. It's every Tuesday and it's always at 1 o'clock. So it's just a different facility to allow us to expand and have more facilitators. And that's where I again get back to Tammy and appreciate the help that you have done and will help with facilitating. Otherwise, it's been kind of a weekly thing that we can now share with other professional RNs in the home health agencies and have more facilitators. The other thing is it's a long, you wonder why we keep going. It's a condition or disease, and Dr. Hutchinson can correct me how all of this works, that doesn't seem to be going away. There doesn't seem to be state or national funding. So therefore, we have had donations, and when you do that, it's tax deductible. They can be sent to 1414 Meyer Drive, Salina. Phone number 785-822-4997. And we'll get a receipt for that. So there's so many reasons. We've expanded and developed a new board and a committee and a medical director. It's such a need. So that's why we keep going. I don't know if you...
Well, Velma's right. It's not going away, and in fact, as our population ages, there will be more and more cases of dementia as people live longer and longer. I know when I was in private practice, I had a number of patients with Alzheimer's disease, and actually this group kind of started with a conversation between Velma and I, that was back before it was any kind of a formal organization. There are some resources, but there's really a lack of family support that is a real need. I always recommended to my Alzheimer's patients' families that they buy the book. It's entitled The 36-Hour Day, and it's a very helpful book for taking care of Alzheimer's patients. It's written by a couple of physicians, so it's from that perspective. But the more resources we can have for, especially for the family or caregivers, the better.
Exactly. Excellent book. And we do have, I think, more than one copy. I have one with me today in the box in the library that we have. So we do loan that out and sign out for that. That's the number one that we start with if they want a book besides all the other handouts that we have. We might go back a little bit to Tammy about sustainability and how we decided to, rather than just drop the organization, how can we grow it, how can we sustain it?
There's a lot of people that do fundraisers for Alzheimer's, and I think that they've always thought that they've needed to give to the national level those funds. And so I think Velma and I got together a couple weeks ago, 3 weeks ago, and decided that we needed to have a local one again. I think I talked about this earlier, because we did get some funds that were quite significant this last year. I think over $13,000 was raised. So with that much money, there needed to be some accountability about where that money was going, and that's where we decided to form the board and to make sure that we were doing it right. And so the funds are going to continue to come in. We have a very strong commitment from some organizations in town that are very committed to giving the money to local, this support group. So we're very excited to see how it's going to keep growing. And as Velma stated, the caregivers are the ones that really need the help, but also there's organizations in town that help those caregivers that we can also donate some money to. So we're in the process of putting a budget together, and the board is giving us that again, accountability for where that money is going to be spent. So it's letting the people in Salina know that it is really going to be spent here locally for our people.
I think one point to emphasize is that groups like this are extremely important because the focus of certainly Alzheimer's disease is a big focus on the national level, but most of the funds that go towards Alzheimer's disease are going for research and treatment and prevention, and I think there's very little funding that goes to support groups, and so that's why it's so important to have local funding for this group.
Exactly. We do appreciate that, and we have had quite a number of donations and continue to come in, and the fundraisers that Tammy and 2 other persons have done lately is just astronomical. And they have fun doing, but it's a lot of work. So therefore, appreciate all of these folks here that have helped, and there are more board members that have helped keep that going, and we'll get it on a little higher scale, hopefully help the people here locally. We have 2 projects that we've developed out of that, and I guess I can say that we, number 1, thought we would take some of those fundings and offer to the home health agencies that have private pay. Sometimes you can go on as doctor will prescribe a Medicare for a reason, but when that Medicare no longer pays, then there are a couple of agencies that do have private pay. So we would like to send that nurse's aide into the home, relieve that caregiver for an hour. We will pay for that visit, and so we'll go according to our budget, X amount of times a year, and X amount of families that we can help with our budget. Second project is one that is a wonderful process that we have in Salina, the Sunflower Adult Daycare Center. Mary Sue Wells has been with that for many years, and if we can just send one family there one time, it's for the day, they can get exposed to that. And the people that come to our group weekly and monthly, we've gotten many of them in there. They may just take their loved one there once a week. Some of them take them 4 and 5 days a week. It gives the caregiver relief, because we're talking about a condition that goes on 10, 15, and 20 years. So those 2 projects, we're so excited, and we have already used the Nurses Aid Project, and so as folks know about that and come to the group, why we can get some of that set up. Back to you, Lori, because you have something that you can tell about that private pay help, or has that been established in your organization? You do social working.
There are limited funds for respite care, and it's just a need that people have, or funding has been cut in respite care, so this is an important area. The support group, people that attend, are able to provide emotional support for each other, and that is really helpful for them to find out that they're not the only ones in the situations, and they share tips and share similar experiences, but also share learning resources. They share their what works, what doesn't, and where they might be able to provide help and where they might be able to get help. So as far as Medicare covering some of these services, there have been a lot of cutbacks, and private insurance is often difficult to have coverage for some of these services.
And certainly Tammy knows a whole lot about that, getting into the home and managing that care, and we'll continue to appreciate that help. The news media recently quoted that in the year 2016, 1 in 8 of us would have some degree of Alzheimer's. And so we do know that the statistics that I have, stats might be just a little bit more than now, but currently 5.3 million have it. It is the 7th leading cause of death, and the costs $172 billion annually, and 10.9 million are unpaid caregivers. So, you know, it's not like we can take a pill or a shot and we're better tomorrow, or we had surgery, we know that we're going to have end in sight, but this again goes on for years, and we don't notice it in the first degree, then it gets to be 10 and 15 years. So we're just trying to educate the public and see if we can't help a little bit with that. I know back to the Sunflower Adult Daycare, Mary Sharp is a well-known speaker and travels the world talking about Alzheimer's, showing videos, because she took care of her own mother. Mary Sharp is from Kansas City. She's a retired school teacher, and she has mentioned many times that she has not found a facility like we have in Salina, the Sunflower Adult Daycare. So we're excited, and it's been such a great relief to get folks there for this condition. We can talk a little bit more about Mary Sharp as it comes, but any other comments? A lot of folks, Dr. Hutchinson, come and they have so many questions. Where do I start? This is a big one. My family physician, do I just jump right in and go to Wichita or over here to our neurologist? How do I know if my loved one needs help? So we usually say, please go to your family physician.
Yes, that's the place to start, and family physicians are trained in the diagnosis of dementia conditions, and that's the best place to start. If it's more complex than they feel like they can handle, then we have neurologists in town, so we certainly have all the facilities here in Salina to diagnose problems like that.
Yes, it's a great help. We do have about everyone we need here in Salina, and some just don't know where to start. So it's amazing the things we talk about in the meeting. It's just all of the help, and that's what we're set out to do, is help. We're not diagnosing and treating any of that. It's help. How can we help that caregiver?
Excuse me,
No,
the other thing I'd like to add is that it's important for the caregivers to talk to the patient's physician, because when I'm seeing a patient in my office, I'm interacting with that person for 15 minutes out of one day, out of 2 or 3 months, and sometimes it's very difficult for me to detect any kinds of dementia problems in that shorter period of time. So I rely heavily on talking with the caregiver to answer questions about memory and cognition.
Exactly, and we appreciate that. Tammy, you helped facilitate meetings and been so supportive and helpful. What have you seen people take away, or what they really need from the meetings when they come?
It's great, the interaction with the caregivers. There's a couple that have been there since the beginning, and they really help the new people understand, the new people that are just dealing with even trying to get their loved ones to take a bath. I mean, it's a simple little thing, it seems like, to all of us, but it's a huge thing to them. And so the stigma of not taking them out into the public because they're not groomed properly. So you can see it becomes a whole big issue. It's not just one little thing. And they're really good about talking to each other, and the ones that have had to deal with it before will go, you know what, I've had luck having somebody come from the outside, just like Velma said, having a home health aide come in and give that back to their loved one, where they'll let them do that, but they wouldn't let their loved one do that. So it's there's different things that they talk about just like that make a huge difference in these new people that are trying to deal with trying to figure out how to just live day to day with this disease process. I think the great thing about this board forming and this group growing and growing is making the awareness out there that there is some help for them. Where I think there's a lot of people that are diagnosed with Alzheimer's in this community that they don't know about the resources, or they're just embarrassed to go out and take their loved ones in public because they don't know how they're going to react in places. So I think meeting with group members and getting ideas on that has been one of the insights that I got in the last meeting I attended just a couple weeks ago. So I think this group is going to be able to help get the word out there that there is help, and hopefully we'll get some of those people that are afraid to come forward and or see that there is help for them and their family members. So
That brings up a good point. Is one of the handouts that we have in the many resources and handouts is a card that, and sometimes it's needed. It seems humiliating and humbling, but we do have to talk about it sometimes rather than have an accident when you go on vacation or go to a restaurant. So there is a card that comes from the media that we printed up and hand out at the meetings, and it says something to the effect of, my loved one has this or that, he or she may do this or that, so please be kind and thankful and forgive us for what we might do kind of wrong there. So just handy things like that, and that has been helpful, particularly on vacation and restaurants. So why would you want to come to the weekly meeting or any time to our group? Again, is to find out the two projects we want to do and are doing. There's handouts, and some of these come from state and national, and sometimes we use the internet. There are clips off of the internet. In fact, you can get on alz.org and take a brain tour. It's kind of hard to look at, but different things like that are on the internet at alz.org. So you can get in there. So all kinds of handouts to, one of them is on the difference between dementia and Alzheimer's. So as I understand, it looks like Alzheimer's is a branch of dementia. And so, things like that, people kind of can study and go home and call their physician and get some help. So we have a DVD that we give out, minimal cost, for folks that will take that home and put it in their laptop and share with their family. One family member recently, I think, bought 4 copies. But that brings up another subject of the resources of your family. But it is Mary Sharp's DVD. I keep bringing up Mary Sharp because we have had her come. Dr. Hutchinson helped with that back in 2010 and 11 at a facility here in Salina. We had like 150 folks came. This year she came again with her husband and all of the video and things that she has to share. We had over 300. So I guess I'm saying she and her daughter Rachel made a DVD, and we'll go over segments of it in our group meetings, and they can take them home. And because that brings up another subject, it's asset mapping that she talks about. You can't do this on your own very well. It's a 24-hour job. At the first, it isn't so much. Then it gets to be 24 hours. So where does that caregiver get help to sleep, go out for groceries? So that's why we hope we can help, as well as letting family members know that they just don't realize how hard the care is, because they're not there 24 hours a day like that caregiver is. So all of these things, and recently we had a survey among the group, And so they did give a verbal survey, do we meet these qualifications on handouts and resources and all the things, the comfort of the room and timely matter. And so that's one reason we decided to move forward. The fundraising and donations have come in, so we can't seem to just drop it as it doesn't seem to be going away. Any other comments that you might have of the group?
I think one thing that's important to mention as to why this group got started to begin with is that this is not just a group of people who have relatives with Alzheimer's that sit around and complain about what their spouse is doing. This is not that kind of support group. This is more of a learning group. We do certainly share information about different problems that people are having, but this group was really formed to fill a void in learning and teaching for the caregivers, and I think it's done an excellent job.
Exactly. Confidentiality, I didn't mention particularly, but that is just a must. We meet as a group. We might sign in so we can get a name or a phone number in case the group doesn't work this particular week. It's Christmas or whatever. So if folks don't want to put down their whole name or their phone number, that's fine. We do maintain confidentiality. Again, that's part of the meeting, is the sharing of how to go about it with your physician, the handouts, the DVDs, is confidentiality, and so that's very important. There is the quarterly magazine that comes from alz.org, so we have that. I got one just the other day, and so then I always take that, and there's an insert in there you can tear out, and if you want to just take that home and order it, it's free. So again, our meetings are free and open to the public. Another reason why we've moved, I guess, from the church to this area, it's larger, we can have a more public place, continue on with professional speakers like Dr. Hutchinson and others. We have had a lawyer just not too long ago, an attorney that visited about the trusts and the wills. So important, because all of a sudden we might be on quite a few medications and we're not all of that cognitive. So did we do some of these things before we can't share it as a couple or as a daughter or a son? That brings up another subject. There are spouses come, we have men and women. There are daughters and sons of their parent. So it just doesn't have any boundaries, is the sad part. There was a documentary recently on television, Glenn Campbell, and we have that magazine and article. You know, it doesn't have any boundaries, so that's what we try to play down, the stigma that has been placed on that. So that's, again, confidentiality is very important. We keep bringing up Mary Sharp, and I might bring her up again because it says what we want to say, but I need to say that some of her words were that we build an active environment. I meant to say that when we were talking about families. Build an active environment of comfort and dignity for the elderlies, your loved one. Many times that loved one can't speak. They begin to not even know who we are, but we're still going to maintain dignity. And so it takes a whole community, in other words, some family members to help. That really is a good support. So that's one of the things we try to do. I might say that we want to make sure that we stress that our weekly meetings are not medical by design. We will have professional leaders Tammy, the RN, Lori, the social worker, doctor, any of those that we have come, professional leaders, but we are not medical by design. Again, it's about communication challenges. As I say, that communication gets jarbled sometimes, repetitious communication, sometimes a lack of cooperation, and sometimes resistant. So we never know what form it's going to take, and all of us might be in a different form. So again, we're stressing that it's acceptance and patience. You try to project the acceptance rather than spending a whole lot of time on what could have been. Again, it's just very hard to accept that particular condition, but we are really trying to facilitate ways to keep that dignity and this long condition. Other comments?
I guess I just want to say that it's important for caregivers to take care of themselves, because if a caregiver is drained, they're not going to have the patience, the tolerance, the endurance to work with somebody else. So I would like to think that people that come to the support group, that they get their cup of caregiving filled so that they can, share their caregiving with others. So it is important for them to get a reprieve, to know that there are resources out there, to know that they're not the only ones out there. And what I like about attending the support group is that I learn from the people that attend. So it's not only just a professional, providing the information or sharing, it's also learning from the people that are out there that deal with Alzheimer's every day, and sharing that information with each other.
That's a very good point, because it's exactly that. I guess I've been at it for 4 years every week, and off and on have helped to facilitate, but I keep learning something because someone different comes, or someone else has been there forever, and there are locks on the door such as different than a bolt, and there's all kinds of gadgets you can buy, and bracelets and things, and these folks point that out, and that's very helpful to share. Again, we do meet weekly every Tuesday at 1 o'clock, and now we'll be meeting here at Residence 600. That's located at 600 East Elm in Salina. So it's on the 3rd floor. So if you come into the facility and take the elevator up to the 3rd floor, that's where we'll be meeting. Again, we appreciate the donations that we have had. Can be contact us or come, any of the members sent to 1414 Meyer Drive, Salina, Kansas. The actual name of the organization is the Alzheimer's Support and Education Group of Salina and surrounding counties. We have extended that thanks to the home health agencies and the facilities that will help with that need. The donations are, we do have receipts for the tax on that, so any donations that come in. And the other thing is that we do is the fundraiser, and Tammy's the leader on that, and there are ways that we can help with that this year. Some of the other minor things that, again, it shows on the internet, and we have those things that, and again, we don't need to get into the medical part of it, but it's the amyloids that are proteins that seem to get sticky and glue together, so therefore we don't have that memory. And it was brought up by someone this past week, how important that is, because that particular loved one is in a more advanced stage. So that every day, that is a new day, because they don't have memory of yesterday. So, it's not, different stages of Alzheimer's. So, just if, for instance, if we're in that stage, and you might find that that loved one might wonder what that chair is doing there and might want to move that chair, it's a new day, even though we knew about it yesterday. So we just learned so much, and I still learn something every week from those folks. Other questions or sharing? We talked about fundraiser and donations. I appreciate all of the help that we get and will continue to grow. And the facility and their cooperation, it's really will help us with speakers and continue in a professional manner. Thank you, panel, for being here today. We thank the facility. Thank you, doctor, for taking your time to come and be our support and help with all of this reorganization is what we've done to continue to share. And any questions, 785-822-4997, or we'll be here every Tuesday on the 3rd floor. And thank you again, Lori, and everyone for coming. Great.
Okay. Cut and print.
Good job. We forgot the sign, didn't we? But
That's
I think, did you get it in there?
Yeah, I'm getting it now.
Oh, yeah, she can.
Yeah, you
She
can-
can,
you
she
can
can,
do it.
yeah,
Good. So do we have a photographer?
yeah,
Right.
we'll just have somebody take it,
And
go down there and get them.
Yes.
Do you wanna do it downstairs in front of their fire?